Hi everyone, my name is Regina Porter and I am here today to talk to you about my evidence-based project relating to early mobility protocol after cardiac surgery. I chose this topic because I work on an open heart surgery ICU and I've personally seen the effects of early mobility on patients in terms of their recovery after heart surgery. The significance of this project shines true that in patients who have had heart surgery, delayed ambulation and typical protocol of bed rest have shown to cause postoperative complications, decreased functional independence, and longer hospital stays. Early mobility protocol aims to mobilize patients within 12 to 24 hours in order to reduce these incidences. This leads me to my PICO question. In cardiac surgery patients, does early ambulation compared to standard care reduce post-operative complications, increase functionality, and decrease length of hospital stay? So in my literature search, I started with using common databases such as American Association of Critical Care Nurses, Google Scholar, and PubMed. I then searched keywords such as ambulation, cardiac surgery, coronary artery bypass grafting, length of stay, mobility, safety, and valvular replacements. I selected my articles based on if they abided by the inclusion criteria of discussion of adult cardiac surgery patients, early mobilization protocols being discussed within 12 to 24 hours post-op, and if they were either a randomized control trial, quasi-experimental design, or a quality improvement project. From a long list of articles, I annotated 4 and then chose 3 to answer my PICO question for the purpose of this project. The exclusion criteria that I found were these studies related to pediatric populations, irrelevant protocols that strayed from mobility interventions, and articles such as case reports, commentaries, or studies that were limited to their relation to the topic at hand. My evidence synthesis table discussed 3 articles that relate to the answering of my PICO question. First, Ahmed's article of the effect of early ambulation on hemodynamic and perfusion incidences post-cardiac surgery utilizes a quasi-experimental design where mobility protocols were put in place within 12 to 24 hours after heart surgery. Evidence showed that this improved patients' perfusion and hemodynamic stability after surgery and therefore decreased their length of hospital stay. Next, we have Cook's Quality Improvement Project, which worked similarly in that the article Early Mobility After Cardiac Surgery, a Quality Improvement Project, aimed to prove that early mobility protocol improved outcomes of patients undergoing heart surgery. This early mobility protocol proved to display shorter hospital stays and quicker recovery for patients in the cardiothoracic intensive care unit setting. Finally, Jalili's article of the effects of early mobilization on hemodynamics and pain after coronary artery bypass surgery utilized a randomized control trial method to illustrate how early ambulation, when done safely, reduced pain and improved functionality in patients after heart surgery. After conducting this experiment, results of the study proved that patients had increased levels of independence and shorter hospital stays. When thinking about how to apply this concept into practice, one should consider implementing a structured and team-based early mobility protocol for cardiac surgery patients within 12 to 24 hours after surgery. They should also develop and utilize a standard screening method for patients to use in order to track their mobility and progress to see if this protocol is having the desired effect. They should then use step-by-step mobility progression. This means that patients should be progressed slowly by going from sitting to standing to walking when safe and clinically appropriate. How this translates is that a quality improvement project with a pre- and post-test design should be used in a cardiothoracic intensive care unit on adult cardiac surgery patients. They should utilize an early mobility protocol within 12 to 24 hours post-op. Results should be measured using tracking sheets with ambulation times, distances, and hemodynamics of the patient. One will then determine if the PICO question is answered, and if this results in reduced post-op complications, increased functionality, and decreased length of hospital stay. In conclusion, the evidence presented supports the PICO question and a quality improvement project is warranted. This is because implementing a structured early mobility protocol after cardiac surgery is a feasible and safe way to improve patient outcomes and help patients get back to normal daily living. Below are my references used for the purpose of this project. I appreciate everyone taking the time to listen to this, and I hope everyone has a happy and safe holiday season. Thank you.